Okay, so here's advanced care planning. Advanced care planning really is for everybody, although we know that people who are more immediate need are those who are in their end of life. Now, it is not advanced medical directive, it is not mental capacity. Please differentiate from that. I have the next slide that talks about difference, so I won't go into that. But essentially, is to tell somebody, right, whether your loved ones or somebody you trust, essentially. And it could be really somebody that you're not related to, but somebody that you trust. What you were, the kind of preference you have when you're unable to communicate your healthcare preference. Right? So the example in that book, right? You will see some examples in that book. Let me just click in there. So you could also use this, go to this website, www.livingmatters.sg. That would take you to this website. Okay, livingmatters.sg. Okay, here we go. So this is the place where one could get a lot of information regarding advanced care planning. What it is, why it matters, who it is for, how to get started. And I want to bring you straight into that. Do you have that with you? The document? You could open that on your own computer. Let me find mine. So here I'm now at page 12, right? Have you experienced the death or near death of a loved one? What have you learned from that experience? Right? That's really for the patient, right? But now, if the patient could understand this, then the caregiver could also use this as a way to get the patient to start talking. Right? Let's look at the next one. My mental well-being, being able to make my own decisions, being able to talk to and understand the people around me, being aware of who or where I am, may be the most important aspect about my well-being. Right? The question is, what are the most important aspects of your well-being? Right? Now, how often do we talk about topics like that with our seniors? Right? Right, shake your head, right? Not very often. Not very often. So advanced care planning, just this workbook, how many pages altogether? 24, gives us a kind of some topics to begin talking. I know that this will be not, many people say not natural, but unnatural in Singapore to talk about this, because I'm not there yet. Fine, you're not there yet. That's the whole point, right? Advanced. Do it way before. Better still do it when you're young and able and strong and economically active. And then, of course, that can change along the way as your health needs change and your personal circumstances change. But this is one way, right, to actually get difficult conversations going between caregiver and care recipient, right? The next one, my greatest fears, page 14. My greatest fears and worries about having a serious illness are, and then there are different things. Right? Often we think that the patient may not like to take too much medication, right? Or the patient cannot tolerate the pain. But it may really just be that that father or that mother of ours just don't want to burden. But when we don't have a frank conversation about this, we don't know. When we don't know, we can't really advocate for him or for her. Right? We can't really make the best decisions on his or her behalf when he or she isn't able to communicate his preference. Right? So that's advanced care planning, really. Right. So there are guides here on page 21. Right. There's some tips here on how you could get started. What should I say to my loved ones? Set the stage, start with a familiar topic, go slow and keep an open mind. The thing about it, the topics are there, right? But how do you go about doing it? What words do you choose? What situation do you begin? These are necessarily non-healthcare topics, right? If you think about it. They're not topics, they're not things that we discuss in a discharge planning session. Typically, I mean conventionally. Now, the more enlightened ones might, right, or will. Right? So if we could put this in our discharge planning session at an individual level, that will actually bring informal caregiving into the continuum of care, isn't it? The other aspect of doing ACP is actually family communication. Think about it. These are actually ways to do this. Is actually topics in counseling, right? If you go to family service center, counseling center. How do I talk? How do I talk with an obstinate senior? Okay, right? That will be topics for informal. That will be topics under counseling. So if we can bring in our professionals from counseling, right, to help these people, right? So we can have courses, we can have workshops, we have incremental levels of proficiency just to teach these 3 points. Just setting the stage alone could be a 2-hour. Right? What if I stay here and my father's in Malaysia? I mean, let's say I'm a Malaysian-born Chinese who became Singaporean, right? And then my father is Malaysian. How do I do that? This is a counseling topic, right? Start a familiar topic. What do you mean familiar topic? How do I start? That's how I start. How do I start? Are you free there? Right? How do we start? Right? So those are not things that you can just tell, okay, go do it with your dad and then come back to me, your doctor. No, the person can't just do it. He or she just you can't expect a person to just do it. Yes, he or she might be very well educated, but it's not something that is just natural or easy to do. Right? It may come to for some families I have seen, we may actually have to rehearse this, like sit there, caregiver, and role play. I'm the patient now. Let's talk. Now you talk, and then I will try to be your father. Yeah. And then I'll practice being obstinate and difficult and arrogant and maybe raise my voice. And then that's the kind of coaching that we require in the family care situation, which will help bring family/informal caregiving into the continuum of care. So that's advanced care planning. It is really topics that begin the conversation. It is really something that, in terms of knowledge, in terms of even in terms of lingo, it isn't something difficult to grasp. It's the doing that we are not used to. That's about it. So that is, to me, one type of integrative informal caregiving, ACP. Okay, let's go back to my slides. The next one.